Hi, Dr. Freitas here, and I'd like to welcome you to our discussion of neck pain. First, what we're going to do is take a look at the neck or the cervical spine, and we'll just describe some of the structures to you. Here you have the individual bones, the vertebrae, and let's turn it around a little here. Next, in between these bones, we have these structures here, which are our discs. And the next structure I want to talk about sits right in between the bones in the back, which are called our facet joints. Now, our facet joints guide the movement inside bending and turning and rotation. We have a number of layers of muscles in the neck, and we'll start off with talking about the most important layer. And that layer is known as the multifidus muscles. And we have these same muscles throughout the spine. We have them in our mid-back, we have them in our lower back. Now these muscles, and we're going to put a magnifying glass on it, are very short. They go from one level to the next, one level to the next, one level to the next. And this allows these muscles to move our individual vertebrae in a very exacting fashion. Matter of fact, they move them so exact that they move almost as accurately as the muscles in our eyes move our eyes. And another fact is that in the brainstem, there is an area where the first four layers, upper layers of the neck, and the eye muscles share the same relay center. So, in going from there, let's just talk about what can happen. What happens is that for whatever reason, whether we are on a computer, doing work at our desks, or we involved in work where we turn more to the right or more to the left, we end up taking and fatiguing these multifidus muscles. Now, when you fatigue these muscles, they become less active and they're not as strong. When that occurs, simple movements of the head as bending forward, turning to the right, turning to the left, if these muscles are not supporting the spine appropriately, they can allow an individual vertebrae to rotate and twist more than it is designed to. When that occurs, we then cause increased stress in most cases on these facet joints. These joints are huge producers of pain. Now, the next thing that occurs is that since these muscles are not doing their job, and their job is actually to control movement and resist excessive movement, when these muscles are not working, an individual neck joint may rotate or twist on itself more than it should. Now what we're doing is we're putting stress on our discs and actually breaking down our discs, causing them to bulge and herniate and that sort of thing. So what we want to do is we want to always have a good functioning core stabilization system, which is these multifidus muscles, and these are the true spinal cores. Now let's describe what happens. These are not the only muscles of the spine. We have other layers of muscles, and this next layer runs from one level to 2 or 3 levels up, and then as we go further up, they run longer and longer and longer until we finally get to our trapezius muscle, which is one big band of muscle across our back and into our shoulder. Now, here's what happens. When these muscles become less active, all these other muscles that I showed you start to tighten up. They start to try to take over for those multifidus muscles. And since they span many levels, they cannot move an individual vertebrae from one to the next as accurately. As we see here, this comes from the head and it comes all the way down and through here. It is attaching on the way, but it cannot produce that fine, accurate movement. When this occurs, we're breaking down our facet joints, we're breaking down our discs. We're producing pain at that time. And we're going to assume the pain is produced on this side, and when it does, as we said, these muscles become less active, and again, all these become more active. So what the ideal thing to do is to try to get these here multifidus to start working more like they should. Now, one of the things that we know is that these muscles here respond to gapping of our joints, and they respond to gapping on the joints on the same side. So if we bend the head and neck over to the left, we are going to gap open these right-sided facet joints, and we're going to activate these multifidus muscles. The next thing that we're going to do is we're going to work some of the side longer muscles on the side of the neck here, and we're not seeing them in this presentation, but there are muscles that run through the side, and we're going to make them work more effectively. That's going to help to stabilize that neck much more so. So when we do this with one movement where we allow these multifidus to work more effectively. We then allow the muscles on the other side that stabilize it to work more effectively. In doing this, we greatly increase the function of these muscles. They control that movement of one vertebrae to the next much more effectively, reducing pain. All spinal treatment, whether it's chiropractic and physical therapy, should be focusing on these muscles here. I can tell you that very few therapies really concentrate on these muscles solely. So these type of injuries will cause neck pain. They will cause pain to radiate down into the shoulder, and there's a various number of patterns that will, of pain that will occur in through here. This can also cause pain to be radiating into the shoulder and into the arm. And one of the biggest things we see from spinal neck muscle dysfunction is headaches, pain in the occipital region, back and through here, pain up in the front of the head and throughout the head. I have been treating these injuries for over 23 years. Our motto in this office is to get you in, get you out, and get you better. Give our office a call, and we'd be glad to help you. Thank you.